Hi, my name is Mallory. I'm a nurse practitioner here with Hagopian Plastic Surgery, and today we're going to discuss compression after tummy tuck, which is a really hot topic. So first and foremost, you have to wear compression 22 hours a day for the first 6 weeks after your tummy tuck, and then for the remaining 6 weeks after that, you can wear it 12 hours a day. Compression is really important for a couple of reasons. One of those is to maintain the aesthetic or cosmetic outcome that we have achieved on the operating room table. Another reason you have to wear compression is to prevent seromas. Seromas are fluid collections that are underneath the skin that kind of look like a visible fluid ripple or wave, like a waterbed or a water balloon. They're typically not painful, and they're also typically not an emergency, but they can cause, again, aesthetic outcomes to be less than satisfying, or at worst, they can get infected. So those are a couple reasons why you have to wear compression. What kind of compression should you wear after a tummy tuck? I'm speaking for our practice here. We like to start with a binder, so a very traditional abdominal binder, and then graduate into a faja or girdle around 1 to 2 weeks post-op. Why do we like a binder at first? Main reason is they're really easy to get on and off and adjust. The first week or two after your tummy tuck, you might not be doing a ton of self-care, and it's easier for your care partner or for us to help you get back in your compression. We graduate to a faja or a girdle a little later, 1 to 2 weeks, depending on how you're healing, because that's when you start to get back to daily life. So you will be doing a little more self-care, moving around a little bit more. Fajas and girdles stay on better. Now, the style of faja or girdle is also dependent on what other procedures you may have had, so you might need to reach out to us for guidance if you're having something else done along with the tummy tuck. But in general, fajas and girdles have more specific sizing, and that is more important when you're further down the line and your size and shape changes. Swelling and bruising after tummy tuck is really normal, and this peaks around day 7-10 and then starts to subside after that.